6 months ago, a dentist could brag about ranking #1 for Invisalign in their city because it was the best way to get in front of prospective patients looking for a local practice. But today, people are asking ChatGPT where the best place to get Invisalign is. And they're getting a short list of practices, and that old Google #1 ranking doesn't mean anything.
So, in today's episode, we're going to be breaking down three different things. First, what's actually changed in the way that Google and AI tools rank your content. Next, we're going to talk about what generic content is and why it's an SEO killer. And then, third, what kinds of content win, and then a three-step process for your practice.
Let's jump in. I'm excited.
Woohoo!
It's no secret, Sarah, that Google has been punishing um, generic and a lot of AI written content. And I think we need to parse through that because,
hmm
AI can write good content, but not if you just say, go write me an Invisalign page. It needs more context than that. But from even a few years ago, and they started this in 24, they rolled out, core updates that were basically punishing sites that had generic content. And as they continue to evolve that, we're seeing those sites drop off. And unfortunately, what do most dental websites have?
Generic content.
They do.
So, if you're not in the marketing space, let's run it back a little bit. So, AI exploded back in 2024, and you started to see all of this crappy, generic, repetitive content just flood the internet, right? And after a while, Google tried to shut that down with their update, I think mid year, because if you can't get good, trustworthy answers on Google, then people are just going to stop using it, right?
Yeah. it- I find that business owners and dentists in particular have a misunderstanding of what Google is.
Mm,
And they always try to game it, or the gamesmanship of Google has been going on for years. And
hmm
the truth of the matter is, Google makes money by delivering the most relevant results. And one of the questions you have to ask yourself as a dentist is like, why would they rank you high? I mean, let's ask that question. That's the right question. Is it because you just started your practice and you want, 70 new patients a month? Probably not. Is it because you've put intentional time behind your website and your content? Oh, okay, now, and you have good reviews. Yeah. So the gamesmanship of Google has always been high, and when AI came around, the early adopters used it to just train a shit ton of content that was trash,
hmm
and that's bad for Google. I did read an article the other day that said LLMs are pushing higher searches into Google, but less effective overall, clicking onto the ads and onto
hmm
the organic. And a lot of it is we still trust Google. We just don't
Yeah,
use it the same way. So your website can't be built the same way.
exactly. So, what does Google actually want? Like, what are they rewarding today? Because it's not the same as back in 2024, right?
Google has been loving, wonderfully consistent all through the history of Google. They want authentic content that tells you about the practice and the providers that work there. I mean, they want real content written for that office, for that practice, for that doctor.
hmm
And generic content is always the casualty. And that's tough to do because generic content is so easy to write. But
Sure is.
it
Especially when we all have access to it with
mhm,
AI, the same generic copy.
it sucked 10 years ago, it sucked 5 years ago, and it sucks
It
today.
sucks now.
Yeah. Yeah.
Ain't that the truth?
I mean, the funny thing is this isn't new. The mechanism by which the LLMs are serving it is new, and I think punishment is now. I think there's real consequences now to having it because
Mhm.
the consumer behavior has changed enough. But yeah, it always
Right.
sucks.
So what's winning today is quality content. And this, I think Google's criteria that they used for judging quality content is EEAT, right? Experience, expertise, authority, and trust. Did I get those right?
You got it.
Nice. So you can remember EAT.
with 2 E's.
with two E's. EEAT. But basically, they're just trying to tell the difference between content that's written by somebody who's actually done the thing you're writing about versus content that was just like generated for a keyword.
Mhm. I when I'm doing research on something, I'm a prospective patient's looking up what a crown is or how did does a root canal hurt or whatever a common search term,
Mhm.
they're probably going to some global or national Wikipedia or something like that. I don't know that those pages have ever been successful on a dental website. What has been successful and viewed on a dental website is the About Us page and the homepage and pages that are about them.
Mhm.
And, when you were talking about EEAT, um, that's where my mind went is like, that's already the content that is the most viewed on the site. Why would we not lean more into that?
So, how would you check this for yourself, like as a dental practice? How do you find out if your content is quality or generic?
I mean, if I think you need to go out there and read it. If it says
Step one,
step 1,
read
read
your
your
own
website.
content.
Yeah, read your website. I mean, I
Solid.
we joke, but how many practices do you think actually read their website? They do it when someone calls in pissed off that
Mhm. Something was
something
wrong
was on there
or
or
inaccurate or
right, but you're not reading your own website. I mean, that's no
yeah.
fun, but you should,
Yeah. So
uh,
read it. And
read it.
I think a question to ask yourself would be, does this apply to any other practice in the country, or
Mhm.
does this like scream Dr. So and so or my practice?
You mean not everyone has state-of-the-art dental implants?
Oh, not everybody treats you like family?
Mhm. Yeah,
What if you don't like your family?
it's a fair question. If you have and surrounding areas anywhere on your website, I'm just gonna call it right now, you absolutely have generic content. So, Google knows it and you know it, yeah, and surrounding areas. Like, it's like Google doesn't know where you are.
Yeah,
To me, that's the biggest giveaway on the homepage of a site that is obviously not written for a human being.
exactly.
Yeah. Now,
Uh,
I think the opposite of that is I do love if we offer dental implants and our state of the art technology is generic, I would like to see how many implants you placed. I would like to understand what not what training you went to in a vacuum, but like and what that means for the patient.
that's the most important part.
And that's the part that I think offices need to focus on is what does it mean to me? Does it mean my recovery is going to be faster? Does it mean you're going to be able to place my abutment and crown on more quickly? What does it mean to
Hmm.
me? Because that's ultimately what I want to know. And even in answering that, you're taking us from the generic into the more specific that now I do know what to do with as a prospective patient.
So the value of generic content has collapsed. And that's not necessarily because Google penalizes you for using AI, but because the similarity of that content is less useful to those that are searching. So that same content that used to be considered like SEO ready is now the content that's getting buried. Like maybe it worked for a while, but it's not working anymore.
I like how you put SEO ready in quotation marks because I think that's incredibly accurate. I think what SEO ready means is so goofy.
Agreed. Well, now that we've clarified that thin generic content is dead, let's talk about what replaces it.
Yeah. Before we get into the good news, we should probably address the elephant in the room. They're a dentist. They're busy. They're prioritizing their time on production and they don't have time to write page after page of content.
Hmm.
And as agencies and other marketers, they don't expect that. They know you can't do that, but you do you do have to give something. And it doesn't have to be hours and hours of content writing. but it needs to be your perspective, your stories, and the clinical experience that you have. And it's not a second job, it's a 30-minute conversation with your marketing team.
Yeah, exactly. There needs to be some, thoughtfulness behind it, some intention behind it. But yeah, of course, we don't expect dentists to be able to sit there and rewrite their content. So, a little bit of good news is that brands that are mentioned in those AI overviews, they actually get like 35% more organic clicks than those that aren't. So, being visible in the AI search is not impossible. It's the same game, but different rules. But the way you get mentioned in those overviews is by publishing content that has a point of view that's very specific.
Yeah. And the irony is dentists know those. They get asked every day at chairside. It's
Yeah.
the questions that people wanna know online are the same questions that you're being asked about the procedures every single day.
Mhm.
And it's one of those things that while maybe it's tried or not fun to answer the same question every day, that is what people wanna know.
Right.
And they do wanna know what's gonna happen with the temp and how long they're gonna have the temporary crown, and is it gonna hurt, and what those are the questions, and articulating those on your website is giving the best signal to the new tools and the AI engines that you're you're producing that style of content.
Yeah. I think we're so used to appealing to everybody, and now it's the complete opposite. Like
Mhm.
we want to be specific and answer questions that patients have about their own concerns and their own histories and like their obstacles. Like if they have something, like if their bone structure is not, adequate, like what does that mean for me for the implants? Like so many little things I think that we can be specific about. Like one thing that wins is having those real patient stories or before and afters, but not just having them on the website. You want to include the details around their treatment, like their history, how old they are, like what their complications were, like I guess the approach for the treatment, like having those details to where somebody else that has a very similar situation can see that and connect with that and be like, oh my gosh, that works for me.
Yeah. And as you were talking, it reminds me of just the wall of teeth that on the
Smile gallery
befores and the
page.
afters, the smile gallery page. Yeah. Like, we've been in dental for a minute. I'm 10 years, 12 years, and I can tell today that page means nothing to me. I
Hmm.
can't tell you what condition they were in or how old they were, and I mean, I could tell generic, roughly, but it doesn't speak to me. It doesn't demonstrate any confidence of your ability. It tells me nothing.
Yeah, you need to humanize
Mhm.
those teeth, the gallery of teeth. While yes, maybe that demonstrates like some authority and that you've done this a lot and you can obviously see the before versus the after is a better outcome, but you can't relate like as a user to a wall of teeth.
I think it's the classic example of so you're saying with your years and years of training and 12 years of school and, $700,000 investment in your craft that you can tell the difference. I'm congratulations, I'm glad for you. The
Mhm.
average human doesn't. Look at that, and
Mm-mm.
it means nothing.
Right, right.
Yeah, and bring the human side to it.
And that's essentially the foundation of what we call story EO here at our agency, which is our version of SEO. But it's about creating content in the doctor's voice with their own practice and clinical stories, like real outcomes, like basically the practice's perspective. That way, search engines can find it and people can connect with it. Do you use your AI for specific questions? You go down the rabbit hole?
Oh, sure. I mean, I from everything, like how to dress better than Andre, and I'll upload a picture of Andre and a picture of me and be like, "How
Who
do I
wore it better?
who wore this who wore this better?" No, I mean, I do. It's funny. I didn't ask that specific question, but I have done that actually.
Mhm.
Andre's so well dressed. Um, no, so probably the most in depth that I'm using it is, years ago, Sophia was diagnosed with celiac,
Mhm.
and she's getting into that middle school party friends sort of thing, and it is challenging. I mean, sometimes they go places where she can have water and a sugar packet.
Oh.
About the only thing on the menu she can have, right? So we've gotten into baking and all this real and so it's not like I'm saying how to make a gluten-free
Mhm.
whatever. I'm I'm asking specific questions like, "Is which flour is the best gluten-free flour?" And then I'm uploading pictures of the batter, and I'm uploading pictures of it halfway through the bake, and
You're getting
I
feedback.
I'm getting feedback as I iterate through. So,
Yeah.
like and I was half joking about the fashion stuff as we do more of these podcasts, one of us has to look good. And so I do. I'm uploading pictures, is getting feedback, and I'm having it ask me questions
Mhm.
that I can provide the answer to.
It's an actual
It
conversation.
right, I'm having a like, we're friends, and I say
Mhm.
thank you and please, so when it takes over, like, it remembers that I was polite. So, yeah, I'm
Yeah.
having conversations.
Oh, same. Like, last time I was sick, I think I used it as, like, my, like, sickness coach. Like, you can tell it your symptoms. I'm like, "I'm feeling really bad, like, this specific thing hurts or this hurts," and then I'm like, "What should I do next?" And
Mhm,
then
mhm.
and then it's that back and forth, it's the conversation, and it goes down it narrows from a broad question, and it just narrows the field to more, 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 more specific results, and so the point of this is that content needs to speak to those specific results as much as possible.
Yeah, those answers are coming from somewhere,
Yeah.
and you need to upload the context of your approach, and
Mhm.
that's where I love story brand and the Story concept we have at the agency is because it's nothing but a framework to help answer those questions.
Yeah, and it's not difficult to do. It just takes a little bit of thought and some work, but let's let's chat about how to make your content more specific. Here's some things you can focus on today. I think the first thing would be just open up your own website, start with your homepage because that's arguably the most important page of the whole site, and ask yourself, could this have been written about any dental practice in the country? And if the answer is yes, that's your first sign that you have generic
You
content.
have the genericism disease.
You have the generic disease.
How do you know what's AI and what's not? Or how do you know what's generic and what's not? Right? Like, what does generic mean to you?
To me, it means kind of that surface level or high level language, I guess you could say. Like a few phrases that we hear ad nauseum is we treat you like family. Like we offer state of the art technology. Like some of those phrases that are like talking without saying anything.
Yeah, yeah, it's just words.
Yeah, it's just words. And then at this point, so many other practices say that exact same thing that it doesn't make you unique.
The irony of all this is one of the best ways to ask if your content's generic in AI is to ask the AI machine.
Yeah, AI is not bad. It's just sometimes the way we use it is bad.
Yeah.
But yes, harness AI. Use AI to ask, like, run an audit of your site and see what's working and what's not.
Yeah, I mean, I know in the show notes we were gonna put some prompts for them to use, but, like, does my website suck?
You don't,
I don't
yeah.
know, like, d does my website tell my story? You know, how does this website content compare to other dental websites?
Hmm.
I mean, we're gonna send it on the show notes, but any of those questions would return something to have a conversation with your marketing team about.
And it's not that you're trying to redefine what makes you unique or what your, USPs are. It's more about taking what you're doing already and just bringing down taking it from high level to specific. So if you say we treat you like family, what does that mean? What does it sound like? What does it look like? What does it feel like? Think about the senses and say things like, it sounds like Melissa greeting you by name when you walk in the door. It feels like a cozy, environment versus a sterile office. Like use specific language to communicate things that make it feel like family versus the broad statement that everybody uses, right?
Yeah. And I don't we're not trying to trigger an existential crisis of who your practice is and what
What your purpose
your
is and
purpose and your vision statement. Those are nice to have, but
yeah.
we're talking about words on a website,
Mhm.
and let's let's hone it around that. What does the patient experience look like? And then use AI to put your vision on top of those words, and
Yeah.
let's just change content on site. Let's just, you know,
Try to put yourself in a new patient's position, right? Like, in my mind, I would want to have a lot of questions answered before going in or before even calling to schedule. Like, if I'm apprehensive about what something might cost, I would love to see very specific details on what insurances you accept, or if you have third party financing or an in house membership plan, like what are those details, not call for details. And then if I'm anxious about a treatment and I'm worried it's going to hurt or what it's going to be like, I would love to be able to go into that treatment page and see what kind of like what I can expect before coming in and how you're very thorough and gentle with your anesthetic and like you make it to where it is almost painless. I think those reassuring details where you can add them on your site are going to be gold.
and I'm saying when we think about dental in our office, there's something around my identity that's like, well, they should just pick me because I'm an amazing dentist, or they should pick me because, whatever. Like, well, yeah, but what are you doing to demonstrate that?
Mhm.
And if you can just, I don't know, change the paradigm a bit and think about the last time that you searched for an eye doctor, or you searched for a podiatrist, or you searched for your kids, allergy, whatever that doctor's called.
Yeah. Allergist?
Allergist, thank you.
Sure.
Sure. What journey did you go on? Like,
Mhm.
and I would be willing to bet if it was something cosmetic based, you probably went to Instagram. If
Yeah.
it was something that you had anxiety about, you probably dug into the demonstration of excellence of how they did the procedure. And,
Mhm.
I don't know. I love dentists. I think they're the salt of the earth, but there is this sort of like this undercurrent vibe that you get of like, "But I'm an amazing dentist, so they should choose me,"
Mhm.
without ever demonstrating the evidence on your site that talks about it.
Yeah, it's like they're living it every day, that's like their life, but it's like the everyday details and mundane things you have to radiate out
Yeah,
because no one else is in that same world that you are. So I think it's like the paradigm shift you mentioned, I think is
yeah,
a great idea.
and congratulations on being the best kept secret in dentistry, but that doesn't help me choose you.
Spell it out to the patients.
Yeah.
So AI didn't break your marketing, it just further exposed bad marketing or bad copy.
Yeah, and based on what we're seeing the next 12 months it's not about ranking in AI search or ranking in Google, like, don't game the system.
Mhm.
Eh, have content that's structured so Google and ChatGPT and Claude can pull specific, accurate, useful information about your practice that patients are likely asking already. Answer the questions there. And let's start there, and don't view it as SEO or gaming the system. Let's operate on a different content discipline that's ultimately going to do you better, because we don't no one knows where we're going, is how deep this is going to go into AI search. But we do know that the more information that is radiated about you on your site, the more specific it is, the more useful it is, the more valuable it's going to stay.
Mhm.
Don't play the short term game, content game.
You're always gonna lose. So, if this episode helped you understand the shift in SEO a little bit more, let us know. We'd love it if you could leave us a review. And if you still have any questions about whether you're a victim to generic content or not, get in touch with our team. We'd love to have a conversation and see how we can help.
That was your bite of dental marketing.